Dr. Hyman, good to see you again.
Thank you.
Love having you here on Health Connection. Topic is lung cancer, and something I did not know. East Texas leads the state in lung cancer. What causes lung cancer?
Well, the major cause of lung cancer is cigarette smoking. 80 to 90% of all lung cancers are associated with cigarette smoking. There are other potential exposures that can raise the risk of lung cancer, one of them being asbestos, especially in smokers. There's a huge increase if you both have asbestos exposure and smoking exposure. And then other things like radon gas and arsenic and diesel fumes and things like that.
Lung cancer, is it symptomatic? What are the symptoms?
Usually it's a cough or persistent pain in the chest, sometimes pain in the arm or weakness in the arm. And if it spreads to other organs, it can be all kinds of symptoms, and weight loss and general failure to thrive.
How do you diagnose lung cancer?
Usually by x-rays and scans and then some type of a biopsy.
I'm going to ask a question that's going to seem obvious, but I ask it anyway. How serious is a diagnosis of lung cancer?
Lung cancer is a very serious diagnosis. The survival of lung cancer that's not caught early is very poor. And so we try to find lung cancers in the earliest stage possible when surgery is still feasible for treatment. Surgery is really the best treatment and is the best chance for cure. Many times even after surgery, we offer radiation and chemotherapy to try to improve even further on the odds for achieving a cure.
You touched on treatment, so let's go just a step further. How do we treat lung cancer?
Well, it depends on the stage of diagnosis. If it's caught at early stage, then surgery is usually appropriate if a patient is otherwise healthy enough to go through surgery. If not, there are various types of radiation therapy that can be used, either single or few doses of radiation concentrated right on the tumor, or if it's more widespread, we may have to open up the field and include the regional lymph nodes in between the lungs and at the root of the lung. Frequently, chemotherapy is used as an adjunct to radiation therapy to intensify the radiation effect. If the cancer is very far widespread, especially if it is stage 4, then chemotherapy is utilized, but then the intent is palliative and not curative.
Right. We said at the outset of this segment that East Texas, Northeast Texas, leads the state in lung cancer. Why is the incidence higher here?
There are several factors, and most of them have to do with lifestyle. The incidence of smoking in our population is very much higher than in other parts of the state. We also have a lot of petrochemical exposure and fertilizers in the agricultural industry, and other exposures to asbestos in the iron foundries that had fortunately been cleaned up by now, but were really a big problem earlier in the 70s and 80s.
Lung cancer is an even more serious problem for African Americans and Hispanics. Why is that so?
Well, in African Americans, there's a higher incidence of lung cancer, and in African American men, their survival is about half of what it is in Caucasian men. In Latin Americans, their incidence is not as significant as it is in Caucasian men, but their survivability is poorer. The factors that lead to these observations are not clear-cut, although in African American men, the incidence of smoking is even higher than in Caucasian men.
Okay. Most importantly in all of this, and you've touched on it, but let's tie it all together. Most importantly, how can lung cancer be prevented?
Well, smoking cessation or not initiating smoking is the key to prevention of lung cancer. In every other kind of exposure that can cause lung cancer, the effects are magnified tremendously if you have that exposure plus are a smoker. So the key to prevention is smoking cessation. Past smokers begin to have reduction in their increased risk for lung cancer after about 10 years and may return to normal risk after 20 to 30 years of smoking, of being off of their cigarettes. Yeah. To qualify as having increased risk from smoking, you have to have had 20 pack years of exposure to cigarettes. That can be 2 packs a day for 10 years or 1 pack a day for 20 years. That seems to be the threshold that increases your risk. So a casual smoker may not have significant increased risk, but an average smoker certainly does in very short time.
Very well. Doctor, interesting. Thank you very much.
Thank you.